Hi, my name is Terry. I'm a nurse here at Carolina Conceptions, and I'm going to be talking to you about a frozen embryo transfer. We often refer to this as an FET. So first off, what you should have done is met with the physician to discuss with them the embryos that you have remaining, and then after that, you should have gotten on some birth control pills. We typically have you start the birth control pills on cycle day 1, 2, or 3 of your full flow bleed. If you don't have a prescription, the nurses can call one in for you. We want you to be on them for a minimum of 2 weeks prior to the baseline appointment. When you come in for your baseline appointment, we'll do a vaginal ultrasound and we're going to do some blood work. The vaginal ultrasound we'll look at the ovaries, make sure everything's quiet, and the estrogen level that we draw for your blood work should be low. If both those are okay, then we're going to go ahead and instruct you when to take your last birth control pill and when to start some estrogen tablets. You would be taking 1 tablet 3 times a day. We do morning, midday, and night. You can take it with food, without food. It doesn't matter, just as long as you remember to try and space those apart 3 times a day. You'll continue those estrogen tablets for about 9 days, and then you're going to come back in for a monitoring visit, which is another ultrasound and blood work. At that time, we should start to see your uterine lining starting to open up, and we should also see the estrogen level starting to rise. So we just want to confirm that everything is progressing as we would expect it to. Then you'll come back for another ultrasound a week later after that to evaluate that lining for the last time prior to your transfer. And at that point, again, we want to see a nice trilaminar lining. We want the estrogen level to be about where it was the week before, and we're also going to check your progesterone level. The progesterone level should be low at this point. Once we get those results, we'll give you a call that afternoon and inform you of whether we're going to proceed with the transfer. The transfer is typically a week after that. The medication that you'll begin but prior to the transfer is progesterone. You'll start it about 6 days prior to your transfer, and I'm going to instruct you on the progesterone injection after I go through the calendar. You'll also start baby aspirin with the progesterone. That's an 81 milligram tablet that you would begin. It's an oral tablet you can take at any time during the day. When you come in for your transfer, there's no restrictions on food, but we do want you to have a nice full bladder. So we want you to drink about 20 to 32 ounces of water. You'll be a little bit uncomfortable. And then we'll take you into the back in the transfer room, and the embryologist is going to talk to you about your embryo. Once the embryo is transferred, you're good to get up, empty your bladder, and then you go home that day. We will have set you up for a pregnancy test about 9 to 10 days after the transfer. And of course, if you're pregnant, you're going to continue with your estrogen, your progesterone, and the baby aspirin. And then you'll be setting up for another pregnancy test and about 2 weeks later an OB scan. And we'll instruct you about that at the time of the transfer. If you're not pregnant, then you would go ahead and stop all your medication and you'll follow up with the physician for further instructions. Let me talk to you a little bit about the progesterone injection. So this will be ordered through a specialty pharmacy. We'll give you that information at the time of the class. They'll contact you and you'll pay for it and they'll ship it right to your house. So now I'm going to tell you about the progesterone injection. So you'll have a sheet with some instructions about the progesterone injection, and then you're going to have your supplies. You'll get 2 vials of progesterone. They're typically 10 milliliter vials. And so you should get about 10 injections out of each vial. You're also going to get a 3 cc or 3 milliliter syringe, and it'll have a needle attached onto it. And then you're going to have a 25 gauge 1.5 inch needle. This is the one you'll use to inject with. And you'll also have an alcohol swab to wipe the area prior to the injection. So the first thing we're going to do is we're going to go ahead and open up our syringe. You're going to have a cover on the needle. Just take that off. And you're going to go ahead and draw down the plunger to the 1 mark. We're just drawing in air at this time. Okay? You'll also go ahead, if there's a tab on your progesterone vial, you can take that off, or you can wipe it with alcohol to clean off the dirt. And then you're going to go ahead and take your needle and you're going to insert this into your progesterone vial, and then you're going to put in the 1 cc of air. Now you're going to flip this upside down, and you're going to look at your vial, and you're just going to go ahead and draw into your syringe 1 milliliter or 1 cc, same thing, of this progesterone. And it's an oil, so it's pretty thick, and sometimes it takes a little bit to get into your syringe. So you're just going to get, once you get your 1 milliliter, you're matching up the rubber stopper right here with the 1 mark. Once you get there, you can take the progesterone off. It will not spill out. And now we're going to take our plunger and we're going to drop it down a little bit to get the medication out of that needle. So we're going to take this needle off because this was just to draw up the medication. And we're going to go ahead and get our new fresh needle, and we're going to put that one on. Okay, this is the one that you'll be injecting with. And we'll take the cover off, and now we have that air in. We want to get rid of that air, so I'm just using my finger down here, and I'm just pushing that air out so that I can make sure that the medication, it's rising up slowly, and I'm just going to just push it just gently, and I got a little bubble at the top. Don't worry if you lose a bubble, a little drop there. Now we're going to cover this up, and we're set. We've already prepared our injection, and that's the first part of this. The second part is selecting the injection site. And so there's, in your buttocks, where you can mark your bottom. It's the upper outer quadrant that you'll be injecting the medication, and you can rotate the site each day, because you'll be giving this injection each day, typically in the evening, but some of you may get specific instructions on when to inject it, but generally it's in the evening, and you can rotate the sites. Some people like to ice the site beforehand. Other people prefer not to, so whatever your preference is. But you do want to clean the area with an alcohol wipe prior to the injection. And then you're going to get your needle, and you're going to take off the top, and you're basically going to frame on the buttocks, obviously. I'm framing where my injection's going to go. And then I'm just going to go ahead and stick the needle all the way in so that the hub of the needle is right up next to the buttocks, okay, right in the, and the needle's all the way into that muscle. You're going to stabilize the needle, and then you're going to take your plunger and you're going to pull it back just slightly. If you see a bunch of blood flowing into your hub of your needle, it means the tip of your needle is sitting in a blood vessel, and we don't want to inject that into the blood vessel, so we would just then pull that out. You would toss that, and then you're going to put pressure at the site. There's no harm in doing that. You're just going to have to drop a new dose of medication, go to the other buttocks, clean it off with alcohol, get your new dose. Again, frame it, dart it all the way in till it's here, stabilize. You do that drawback again, there's nothing there, and then you just slowly depress the plunger, and the medication will then go into the muscle there until your gray stopper is all the way to there. One thing to note is that this is a very thin needle, and this is an oil, so you're not going to be able to just push it in quickly. You might have to apply a little bit of pressure to slowly move that progesterone into the buttocks. Once you've got it all the way in, you pull it out, and you want to put pressure on the site. You also might want to give that buttocks a little bit of a massage after the injection. That will help with kind of the muscle soreness as well, and maybe even move around a little bit instead of just sitting still on it. So just give it a little movement. You don't have to walk around the block. You just move around a little bit. It'll help to get that medication absorbed. And then after that's done, you'll just put all your stuff away. Each time you give an injection, you'll get new supplies, and you'll be doing this the next night. Try to keep it around the same time each evening. I hope this video was helpful for you, and if you have any questions or any concerns, you can always call the nurse. Our number is 919-782-5911. We're at extension 106. You can just leave a detailed message, and we'll help you with any questions or concerns that you have. Thank you.